and update.
Mr. President, thank you for this opportunity to present our information about the 2025 HFI program information, and we're here to let you know that it was a very successful year. First slide. The 2025 HFI cycle was marked by successful community partnerships and a broad expansion of preventative services. This included grant distributions within our community that awarded over $1.3 million to 13 local not-for-profit organizations. We also used funding to develop our own internal Department of Health programming that addresses key community public health issues such as maternal infant health, radon, which is the second leading cause of lung cancer in St. Joseph County, and growing our lead program that included a community lead renovation, repair, and painting training, as well as visiting preschools throughout the county. Our next section is about financials, and this is Amy.
Hello. The chart before you is just HFI funding from 2025, and it is broken down by core service. The bar in blue is the Department of Health expenditures for HFI, and those in yellow are our community partners. It is broken down by core service, and the bottom lists the percentage of the expenditure that was spent on the core service. As you can see, the three highest funded core services were the access to and linkage to clinical care, chronic disease prevention, and then maternal and child health. In 2025, we did award 15 grants between 13 community partners covering 6 core services that were most in need in St. Joe County. Next slide. Due to the 73% reduction in funding between 2025 and 2026, we did lose the radon mitigation program as well as funding to our community partners. Next slide. In the absence of HFI funding, as well as any other funding opportunities, these are the Department of Health programs that would be lost. Next up is going to be Brandon Gary, who is one of our data analysts.
Amy, sorry, that last slide, what was your, what's the takeaway on that one? The loss of funding slide?
If we were to lose HFI funding and we're not able to obtain any other funding to support those programs would be lost.
So if it went from what it is now to 0, is that what you, okay, thank you.
Yes, thanks, Amy. This part of the presentation, I'm going to give an overview and highlight some successes of our community partners that were provided funding.
Excuse me, would you introduce yourself real quick?
Sorry, Brandon Gary, data analyst. Right there. Yeah, that's the first one. Wait, back one more. Yeah, so first off, looking at all 13 of the organizations collectively, of that 1.3 million that was awarded, just under $890,000 was claimed in 2025. We had programs that varied throughout the year in their operation and also the funding that they claimed. Some were very consistent month to month, and some were more seasonal, as we have documented. Some peaked in the summer, some were more active in the school year months, and more dormant in the summer. The chart here, you can see July and December, we have a little bit of a peak in terms of when funding was used. Otherwise, it's generally consistent to be around 60 to 80,000 each month. So that just kind of coincides with the idea that we had funding that was being used throughout the entire calendar year of 2025. Go to the next slide. And then collectively with that money, the 13 organizations were able to provide 288 classes, events, workshops, really just group settings that they're able to give education or testing, whatever the service it is that they're providing to thousands of residents in the county, including those thousands of people, along with services that were direct, more individual. We were able to reach over 64,000 people with this funding. And I should say our community partners were able to reach them. You can go to the next slide here. So when we factor in the 890,000 that was claimed, along with the 64,000 people that were reached, we can deduce that on average, every community member who was impacted by our community partners cost about $13.82 per person. Keep going. So that was an overview collectively. We'd like to share 3 of the programs that we funded and highlight their success. The first one is Unity Gardens. Unity Gardens has a mission of connecting people through fresh food, nature, and each other. So their primary focus was to improve community wellness and prevent chronic disease, specifically obesity and obesity-related diseases, as well as provide education on growing fresh produce. HFI funding in particular for 2025 was used to support their growth of satellite gardens. So their main campus, they've maximized the space that they have, and they've begun to branch out and provide satellite gardens throughout the county to continue to be able to provide the food for free and other services outside of just their main campus. So in addition to promoting their satellite gardens, they're also able to increase education, outreach, and awareness to continue to bring more people to their main campus where they're able to offer more services and where more produce is grown. You can move to the next slide here. They set 4 KPIs at the start of 2025 to track their progress, as well as a goal for each of these. This was square footage of green space maintained, number of total sites for their gardens and orchards, visitors to their main campus, and total number of volunteers. As you can see, based on the percentages, the goals that they set for themselves, they were able to not just hit, but in some cases exceed by quite a large margin. You can go to the next slide. Moving past just a percentage and to give you an actual number here, they were able to maintain 640,000 square feet of green space at over 40 sites. They have all the sites listed on their website as well as a map if you're interested in learning more about those. They also brought in over 24,000 visitors to their main campus and were able to recruit and support 3,000 volunteers. Unity Gardens, in addition to 2025, they were an organization that we provided funding to in 2024, which they reported 14,398 visitors that calendar year. So from 24 to 25, they saw an increase in 66% in visitors to their main campus. And in terms of HFI funding that we provided, it was an increase of approximately 20%. So year to year, they were able to not just broaden their reach in general, but actually have a greater reach per dollar that they were funded through HFI. You can go to the next slide. And so keeping with the trend here, if we count the main visitors to their campus as well as the volunteers that they had work with them, 27,445 community members were impacted by Unity Gardens in 2025. With their award amount, we can deduce that down to $3.94 per person. Oh, one more. The second organization is Play Like a Champion Today. This organization has a primary focus of improving access to of sports to elementary and middle-aged students. And not just improving access, but the quality of sports. They have an emphasis on avoiding the win at all costs mentality for youth sports. And they really aim to bridge the gap that is growing in youth sports for pay-to-play models, expensive clubs, access to equipment, all the barriers that kids nowadays see. They aim to provide that for free to children who otherwise might not have that opportunity. And so in addition to giving them that opportunity, they hope to promote healthy physical activity habits as well as build character in ways that team sports and proper coaching can. HFI funding was used to build and implement after-school and summer sport programs across 19 schools here in St. Joseph County. And they were able to enroll and train coaches to fill these roles and coach these kids. I think it's also worth noting that the coach volunteers they have are put through a coaching clinic that they sponsor. That clinic is accredited through the United States Center for Coaching Excellence. So in addition to developing healthy habits for the children, they hope that the education they provide to the coaches can then be, taken into the future to use for any future coaching that they might do for youth sports. Next slide. They set 3 KPIs here: number of student participants, total number of coaches enrolled, and the number of new sports-based programs. As you can see, the goals they set for themselves for coaches and programs, they were able to achieve, although they fell short for the number of students. This organization saw a barrier in the summer when kids were not in school. They had a harder time recruiting them into their programs. They had a plan and it just wasn't as effective as they thought. Additionally, the funding they received, they wanted to set an ambitious goal to reach a number of students that they hadn't done in the past. This isn't a brand new organization, but they were hopeful that the funding would allow them to reach a number of students that they just hadn't done before. And so even though they came up short at only just over 50%, you can go to the next slide, they were still able to reach nearly 1,600 unique elementary age students. So that's 1,600 kids that otherwise may not have had that access to sports, which I still think is a positive takeaway from the program itself, even if their goal of 3,000 wasn't fully achieved. In addition to that, they were able to train 112 new coaches in addition to the coaches that they already had working with them. And they developed 114 sports-based programs, and that included 7 different sports that they offered to the children themselves. Next slide. And so just kind of to wrap up their success, if we count the coaches that they provided training to and the students, the program directly impacted over 1,700 members of the community, 1,600 of which were elementary and middle school age children. And then the third and final program is Cultivate Food Rescue. Cultivate aims to reduce 2 problems in the community, and that's food waste and hunger. So Cultivate is able to rescue food that would otherwise be moved to a landfill. They're able to pick up food from grocery stores, restaurants, distributors with their own fleet of refrigerated trucks, move it to their warehouse, and then professionally repurpose it into balanced, nutritious meals that are packaged and can be microwaved in the future. Cultivate has a couple different programs. HFI funding was specifically used to promote their backpack program. So they would package a literal backpack with 6 of these meals that are repurposed and delivered to students in need on Fridays so that students who face food insecurity at home, they can bridge that gap between the lunch they receive at school Friday and the breakfast they would receive at school on Monday. So they mention 68-hour weekend gap exactly between those 2 meals. So they're provided 6 meals every week so that they can come back Monday well-fed and ready to learn. Go ahead. They established 3 KPIs at the start of the year: total number of meals distributed, number of new students reached, and total pounds of food rescued. And based on the percentages, they exceeded the goals they set for themselves significantly. I actually think they achieved their goals by the end of July in 2025. Next slide, please. And more specifically, they rescued over 2.3 million pounds of food in 2025 alone that otherwise would have been wasted. And with that are able to provide over 127,000 meals to these students that face food insecurity at home. And that was provided to 413 new students. So that's in addition to students that they already reached in prior years and continued to provide meals for. So 21,000 backpacks was the rough number. Again, it's about 6 meals per backpack. So that comes out to approximately your 127,000 meal figure right there. And I think it's worth noting too with Cultivate, they were another organization that was funded in 2024 for the same purpose. They reported 8,674 meals distributed with the help of HFI funding. So that is a 15 times increase from 2024 to 2025. I just think it's a really good example of continued financial support really expanding their reach. And then to kind of wrap up their success here, we're really proud of this number. The 127,000 meals that they provided, when we factor in the award amount that they received, we can deduce that each meal cost only 59 cents. So addressing a problem in the community in a really cost-effective manner, and we wanted to make sure that we highlighted them. So good. Now I'm moving on to Jessica. Thank you.
Thank you.
Hi, I'm Jessica Dilling. I am an environmental health specialist with the Department of Health and one of the people that helped to create this radon-free homes initiative that we started at the beginning of 2025. And really, we started with the goal of just to raise awareness within our community of the danger, of the risk of living with radon, since our county in particular in Indiana is one of the highest counties with elevated radon levels. Nationwide, about 1 in 15 homes have elevated radon levels, but in St. Joe County, it was purported to be 1 in 4, but as we did the research and got the results in, we're finding it's about 1 in 3 homes with elevated levels. And most of the residents in St. Joe County really don't know what radon is, other than maybe it's a test that they do if they're selling or buying a home, and they don't know what causes it, what can control it, and what, the risks are. And so we really just wanted to raise awareness through developing some educational material, through some outreach in our community as far as revamping our website, distributing that material in a variety of different outlets, and then to also provide free testing and possible remediation for homes that needed it if they met the qualifications. So, not yet, sorry, if you could go back. So basically, the EPA level of an elevated radon that would require action in any home is measured in picocuries per liter of air. So 4 is the radon action level where they would recommend that you absolutely remediate your home. And if it's 4 or above, just 4 is the equivalent of smoking 8 cigarettes a day. And so many homes have much higher levels than that. So it's exponentially, dangerous as the radon levels go up. All right, so now you can do the next. So basically, we developed a protocol, a couple of goals. And again, you can see some of the educational material that we created. We developed in-house and then printed it to distribute at libraries, at health fairs, community outreach events, et cetera. And so in addition to distributing these educational materials, we also wanted to kind of contract with a company that would provide free at-home radon tests, and then work with some potential contractors locally to provide that mitigation system if necessary. So we were able to do that throughout the year. And then you can go to the next slide. So overall, initially when we created this program, we had a goal of having just 50 homes tested and then 25 potential remediations. So if you can see our numbers in 2025, we distributed over 800. And of course, not everyone is going to, complete those tests and turn them in, but we had over 300 return tests. So our goal of 50 was exceeded quite well. And then 104 of them were elevated results. So again, about 1 in 3 that we've found. And we are proud to be the only county in the state that offered free remediation to anybody, let alone 54 homes that we provided remediation funds for. So we went above and beyond our goal by over half. Unfortunately, we're seeing, as the lack in HFI funding for this year, that it is impacting the interest of residents to get their home tested when there is not even a possibility of getting that remediation at least partly paid for by us. So we have seen our numbers drop so far in the first quarter of 2026, but it's just such an essential program. I feel like it's one of the biggest environmental health threats just living in this county across all demographics. Everyone is at risk for it. And it does lead to 21,000 deaths per year from lung cancer within just the United States alone. So that's all I have.
Renata Williams, Director of Care. For HFI funding for the programs that came out of the care unit, of course, we're going to talk a little bit about EMBER, which is our Empowering Moms and Babies Through Education and Resilience. And just a little background for those who are unaware, the reason why we developed EMBER in the first place is a response to some feedback that we received from community members during our health cafes. And some of the key takeaways that they said they needed was enhanced prenatal care and postpartum care, mental health check-ins and peer support, parental support and resource connection, stigma reduction, and health education. Next slide, please. So that birthed EMBER. In 2025, we were able to see 129 unique participants. So that means that is the number that makes up the 1362. So a combination of those 129 people participated all year in classes that we had every Tuesday for class and every other Tuesday for support group. So that's how we got to 1,362 participants. And in those classes, we really do a deep educational dive into all of the topics that we cover, which is postpartum support, warning signs, safe sleep, creating your network. One of the things that we thought when we created EMBER was to tell moms how to create their support network, because that was really important to them. We did not think that we were going to become that support network, so we are very proud of that. A lot of the moms, when we were having in-person classes, were texting each other, they were writing together. They repeat the classes over and over. Although it's pretty much the same content, sometimes we do have different guest speakers that help facilitate, so it may have a different spin on it, but we had become the community. So the subject matter experts are some local physicians. We have dentists, doulas, lactation experts that really provide that subject matter expert component piece to it. Next slide. And then for 2026, with HFI funding, we were able to scale up the program and we moved it online. Some of that was in part to the cuts, though, honestly, so that we were not able to have the costs for the in-person. We were holding the classes in person in the 46628 zip code, which is the highest zip code for our infant mortality rate, to try to make it more accessible. So we cut that cost, but we were able to scale it up by going online, because some of the feedback that we did receive from the participants is sometimes travel was a barrier and sometimes childcare was a barrier as well. So now we have our classes online and it is every Thursday, and that was feedback from the group. We did a community poll to see when was the best times for moms, because originally we had it on Tuesday, and Thursday evening collectively was the feedback that we received for that. So now we have our class every Thursday from 6:30 to 7:30. We push 5:30 to 6:30 is a class, and 6:30 to 7:30 is a support group. So we pushed it back a little bit, again, using feedback from the community, from the moms, to make sure that our programming is accessible to them. And then we have our example of the classes here. These are how the subject matter experts fit in, depending on what the topic is. As you can see, creating a safe home for baby, we had several subject matter experts help facilitate that class as well. Participants do receive some incentives. We have raffles. They get babe coupons. They can get a car seat, a bedside sleeper, Pampers, stroller. They do have an option to choose. So next slide. And then also with HFI funding, we were able to grow our maternal infant health home visiting program. So we already had a community health worker that rotates among the Women's Care Center locations, and that is to provide the essential services when women are finding out they are pregnant initially, early in pregnancy. So that is insurance navigation, provider referrals, additional support for other community home programs, community-based programs. And then we were able to grow that into home visiting. So after they deliver, we do have 2 community health workers. One is bilingual that provides home visits. And during the home visits, they're able to expand on the breastfeeding education and support. The safe sleep education is strengthened and encouraged. We do postpartum support, continue resource navigation. And then there is a Growing Gray Kids evidence-based curriculum that they follow. With HFI, we were also able to rebrand our room, Give Your Baby Room to Breathe. So we were really excited about that. We partnered with both birthing hospitals and provided over 1,000 pieces of safe sleep education to them for them to distribute to moms when they deliver. And that's something that we continue to replenish. Next slide. Next, on to chronic disease prevention. So as Dr. McLeroy mentioned, we do have a health promotion specialist that teaches chronic disease health promotion classes in the community. So in 2027, that program is funded by HFI as well. We were able to reach 297 total participants through 25 classes. And in these classes, she really reinforces the importance of the education, knowing what chronic disease conditions are, the importance of following your provider's recommendation in a accessible way for community members to understand. We do provide pre and post questionnaires just to sense if there was a knowledge gain. For example, there's extensive nutrition, how to read a nutrition label. And we ask them, were you familiar reading a nutrition label on a scale of 1 to 10? And then afterwards to see what that growth is. And so in 2026, next slide, building off of that momentum, we were able to provide free health screenings with our community health workers. So we are now in partnership with the library and as our primary partner, and we do have several other secondary partners that on our website, you'll be able to see where we're at in the community. And our community health workers are providing free health screens that include blood pressure checks, A1C, a full cholesterol panel, BMI, and we still can do continue to do the insurance navigation and the provider referral. The idea of the chronic disease prevention, also HFI funded expansion, is to be able to connect with community members where they already are, where they're already gathering, and provide that essential education, talk to them about some lifestyle changes, make sure that they have a provider and that they're seeing that provider in order to reduce the chronic disease burden in St. Joe County. That's all.
The key takeaways from this, our future challenges are concerns about reduction in HFI funding. The reduction in funding eliminates our ability to fund community partners that are leading the initiatives. We don't want to reduce our staffing any more than we already have. And it also is a difficult time to get additional grant opportunities right now. And so a reduction of funding would really be difficult. We do have future potential. We want to continue to grow our existing programs. We want to build additional programs to address public health needs as able. We'd like to digitize our units so that we're not going to be paper-based and much easier to access and much easier to obtain information for individuals needing information. We are in the midst of trying to create more consumer-facing dashboards on our website, and we really want to optimize our public interface. So lots of potentials. And I think as we reflect on our milestones, I think that I have immense pride and gratitude for the collective effort that defines our department. It's an honor to serve alongside such passionate and committed group of individuals. To our Department of Health staff, your hard work and unwavering passion are the heartbeat of this organization. Every day you show up with a commitment to public health that changes lives. Thank you for your tireless dedication to our mission. To our Department of Health consultant, Dr. Diana Purushottam, I want to extend a personal thank you to you for your wisdom, patience, and mentorship. Her guidance has been invaluable not only to me, but to the leadership of each of our units across the department, and we are a stronger team because of her support. To our Board of Health, thank you for your steady support and encouragement. Your guidance provides the foundation we need to navigate challenges and pursue excellence in all we do. To our County Council and our County Commissioners, we are deeply grateful for your continued support. Your investment in public health is an investment in the future of our county, and we appreciate your partnership in making our community a safer and healthier place. To our Indiana State Senators and Representatives, we especially thank them for their work regarding Health First Indiana funding. These resources are vital to our ability to deliver core public health services, and advocacy at the state level is making a tangible difference locally. Finally, to our community partners, thank you for your service, ingenuity, and collaboration. Our work is only possible because of your partnership. Together, we are building a more resilient and connected health network. Public health is a team sport. I'm incredibly proud to be on this team with all of you, and I thank you for all that you do. Are there any questions?
Questions for Dr. McGreevy? Comments? Please, Dr. McGreevy.
Just a point of clarification. On page 25, talks about the reduction of funds for 26 and 27. And there's a significant list of things due to loss of funding. And then one page, maybe I got my pages mixed up, but it's sort of like we're excited about what we're doing, and the Ember program is a key example, but then I'm reading that the Ember program is on the constant verge of not being here. So along with a whole lot of others. So on one hand, it's the same problem we've had for years. You're doing great with what we have, great staff, working hard, figuring out how to get by with less year after year. And then we come back to-back years with, we might lose a program that's effective, again, because of money. And I'm just at odds with where does this all end with programs that we need and are successful, and how to support those beyond our means we get from the state or other grants. So I don't know the answer, but I read the list of all the great work that's been done, and then I get depressed for all of the work that hasn't been done because we don't have the money to do it. So I don't know the answer to that. It's been here for a long time, but I just curious to,
So I'm an optimist. I think that we can still speak. Our biggest concern is that they would ever cut back on HFI funding that we've been awarded. So the first 2 years, 24 and 25, we had a budget and we got a large amount of money and we were very good stewards of the money. We were very cautious about how we spent it. And if you talk to anybody in the health department today, they will tell you that I'm always like, we can't, I keep telling them we can't afford it. And we try to be very, very conscientious about how we spend our money in a very intentional fashion. So that was 24 and 25. 26 and 27, that money, we know how much we have for 26 and 27 based on the legislative session that ended in May. And so we know how much we're going to get. The problem is we don't want that to be cut. When we came up with a 5-year plan, Dr. Purushottam and I sat down with Amy, our financial director, and we looked at creating a 5-year vision in terms of money and how we're going to allocate it and how we're going to save it and how we're going to be very intentional with our spending. So this would be worst case scenario if HFI was completely eliminated at the next legislative session that will determine the next 2 years because it's done on, the budget's done on a 2-year cycle. So for the next couple years, we're going to stay the course. We're steadying the ship and we're staying the course and we're sailing ahead. Our concerns are that we share how we appreciate what a successful program it is here in St. Joseph County with our state representatives and state senators so that they understand how important it is to continue receiving the money. It was reduced by 73% during the last legislative session in the budget. We can't afford to lose any more from it. So if we can just hang on to our current budget and either get more but not less, or stay the same, we're good for we have a 5-year budget. So I'm asking you to speak to your state representatives, not to cut it anymore. And if they could give us a little bit more.
can I respond?
You may, sure.
There isn't a person in this room that doesn't believe in the people that work here and the hard work that's ahead with limited resources. But beyond this room, I don't know that the St. Joe County community understands what we just saw, which is the outstanding programs and the work that's being done and the risk of it being cut at the whim of a vote in Indianapolis. So politically, I don't know how we fire up the community that you're serving to take a step forward and help develop a larger financial campaign. One, just in case we lose what we have already. But we shouldn't be losing. We should be, based on what we've seen, your work demonstrates that we should be getting more because you're working harder with less and rewarded for that. But that's not the way the legislature works. We don't recognize performance, we recognize equity. And so I'm wondering if we need to carry a message broader to the St. Joe County community that great things are happening here and they're at risk of not continuing because maybe a lot of people don't know about it, or we haven't been political enough to go out and get the major medical players in the community involved, or we haven't gotten the economic development people involved. One of the major components of economic development and bringing these data centers and everybody to the area is first, do you have the employees that will come here and work? And second, what is your health care in this situation that we're bringing people to? We're bringing people in all over the country to work here in St. Joe County. And those are the two most important things. Can you get the best worker, and can you take care of their families? And all those families aren't coming to us perfectly. They all have medical issues. They all have kid issues or psychological issues or all kinds of things that you deal with every day. And I'm continue to be bothered by the fact that we don't have a large message to say, you're in a great place, but we risk losing it for apathy. Because you think you've had it forever, so we don't need to work any harder. And that's frustrating. There needs to be a plan developed for road to improvement, I believe, to get more people involved in what's the great news here, and how do we accentuate that and broaden that scope and communicate that scope across St. Joe County, so that the legislator downstairs or downstate, when it gets to that point in time, they know they have one community that's going to be there knocking on their door saying, hey, you can cut anywhere else, but you're not cutting here, because look at the results we've done, and look at the energy and the synergy that we have in the community. These big companies are not coming here because of, farmland and others. They're coming here because they see the potential profitability and the quality of life that St. Joe County offers. And I know that from working with Project Future for years and on and on. But enough of that lecture. But I'm getting more frustrated that more people don't care about what's happening here. It's just fantastic work you're doing with limited resources, and it's been going on for years. But unless we organize, synergize, and communicate these kind of things, then, we're going to continue to see the same threats year after year after year. End of lecture. Sorry.
Thank you.
Any other questions for Dr. Migliori?
One thing that I wanted to, just kind of a general point with Health First that I appreciate is that, Health First money came with certain strings attached, different areas that they wanted us to focus on. And over the past couple of years, I've felt that the department has tried to be very intentional in using that money in a way that is addressing all of those needs. Even though it was a pretty big list that we had we always called it the buckets, but the buckets that we had to kind of check and make sure that so I appreciate that a lot. And I want to say also what I appreciate is that even though losing the Health First money last year was obviously very challenging, there is still a lot of optimism that I'm seeing in the department that we're still able to do a lot of good work. And I appreciate that that mentality of we will do the best we can with what we have and just take advantage of the resources that we have. And then also go out and find whatever help we can to help keep these programs going. I want to say I appreciate that. And yeah, and I guess I wanted to ask also some of the programs when you're talking about incentives and other things, how are community partners? I guess, for example, we have the Fair Foundation that came forward and gave us a donation, and I think a lot of the things that we offer, car seats and things, I know we're finding them through grants and we're finding them through donations. so I guess what I'm seeing is that even in these smaller ways, the community is coming forward to help support these programs. And I don't know if you wanted to speak to that aspect of some of these programs.
Yeah, I mean, we have been very fortunate. We have a wonderful community. We have an incredible medical community. We call them and ask them to come and talk to the Ember Group. They take time out of their very busy schedules to do that. It's still important to them to take care of the community as well. But other ways we're looking forward, we're doing a presentation at the St. Joseph County Medical Society in May. We look for ways to network. We're looking at starting a foundation, an arm of the health department, a not-for-profit that basically allows someone to contribute to the foundation, either with items for school hygiene that's needed, or clothing to keep kids in school, keep kids in the classroom. But that would give a mechanism for individuals in the community to donate, like the fairs so generously did, but be able to use it as a tax deduction. And so that would free up, more encourage people. Right now, there's no tax deduction. They just, part with whatever they donate to the projects that we're doing. But by starting a foundation, we're going to be able to open doors to apply for more grants that governmental agencies are not permitted to apply for. So having a foundation will allow a tax write-off for donators, but also allow us to apply for grants that we currently are not eligible for. So we are looking ahead. We are recognizing that it's not always going to be a sunny day outside, and we just have to buckle down and roll up our sleeves and keep our nose to the grindstone.
Thank you.
I just have a quick comment. I just wanted to thank all of you. That was actually a really good presentation, and it was nice to hear about our partners and their success. So just thank you.
Thank you. They're wonderful, wonderful group. I know I say it all the time, but it's true.
All right, just to close this out, I'll echo my appreciation. And I think you and Dr. Purushottam and staff were very clever about the way you use those funds in a smart way, reaching out to community partners, which did a great job, it sounds like. And if every county would have done that, I think we would have maintained some funding. But when the legislature was debating this, they heard so many stories from counties that just flittered away the money. So they didn't feel like in those counties, it was a good place for the taxpayers' dollars. And unfortunately that costs us. But with reports like this and presentation and maybe some media exposure, maybe we can talk to the legislature. Those counties that are using it effectively and providing meals for 59 cents, my gosh, they should get funded. If the other counties aren't as organized and are as frugal and responsible, then maybe not. So that's my hope. All right, thank you. Do we need
Thank
a
you
vote
very
on
much
this?
for your attention.
Oh, you're welcome. Thank you all. No vote. All right, next item on the agenda, 20